Anything that is interfering with your sexual satisfaction is erectile dysfunction. There's no way to really make a penis longer. It's not just that the medical field won't talk about sex. There are a lot of partners and a lot of relationships and marriages, they don't talk about sex either.
Meet Dr. Debra Durst, founder of RevitalyzeMD, an expert in regenerative medicine. Dr. Durst is dedicated to empowering your wellness journey, enhancing your health from the inside out.
Today, we're going to talk about sex, about your sexual health. We're talking about penis, vagina. We're talking about climax. We're going to be talking about all of this stuff you guys are scared to talk about.
Patients are proactive with this. They're ready to talk about it.
They are. Yeah.
Nobody's listened to them. Nobody's opened those conversations. The primary care doctors, the gynecologists, the urologists, no one. If you treated the root cause, which is low sex drive or sexual dysfunction, you could correct the depression.
A male, how long should they actually last during sexual intercourse?
So the average duration, do you know how long women wanted it to last?
Shoot, tell me. Welcome to another episode of A Healthy Point of View podcast. I'm your host, Sam Tejada, and today we have a special guest, an expert, someone with many, many years of experience as a medical doctor. We have Dr. Debra Durst with RevitalyzeMD. She's a health and wellness expert specializing in sexual health. Today we're going to talk about some of the things that people are scared to talk about, right? We're going to talk about sex, about your sexual health. Yes, we're talking about penis, vagina. We're talking about climax. We're going to be talking about all of this stuff you guys are scared to talk about. At the end of the day, this is something that we all need to make a priority. We know that this is important. And we have Dr. Durst, who is 25 years in emergency medicine. And in my opinion, if I have issues with my sexual health, that's an emergency. So, Dr. Durst, how are you?
Great. It was so nice of you to invite me. And I'm excited to be here and talk about sexual wellness.
Yes.
Thanks, Sam.
I'm excited to just go deep into this.
Yeah.
You specialize on both males and females, right?
Correct.
Where do you want to start?
Oh, well, I think that you did a great intro, and the taboo aspect of it is a good place to start. It's
All right.
very taboo.
Yeah.
People don't want to have those conversations. So I think just opening conversations and talking about sex.
Let's do it.
Yeah.
So you have a lot of patients that come in. How difficult is it to actually start having those conversations? And the reason I'm asking this is that we have a significant amount of doctors and PAs and nurse practitioners that tune into this podcast. And a lot of them are trying to get more involved into some of these other services and modalities that'll benefit their patients, right? So sexual health is one of the ones, even within our locations at Liquivita, some of our new practitioners, they're very hesitant about it. So how difficult is it to have these conversations with your patients?
So I don't find it difficult at all. So I will just start with, I'm in Tennessee, and Knoxville is the Bible Belt. So you would almost think that it's difficult there, but patients are proactive with this. So they know that there's changes. They see it. You know, a guy, he starts having problems with erections, just a little inconsistency. It happens once or twice. So they're thinking about that every time.
Right.
You know,
right.
is that going to happen again? And so they're proactive when they come to those providers, and we need more providers doing it. They're ready to talk about it.
They are. Yeah.
Nobody's listened to them. Nobody's opened those conversations. The primary care doctors, the gynecologists, the urologists, no one is asking those questions or opening those conversations. So I think it's very easy. And patients are more proactive than providers in the medical field with this. As you know, there's no sexual education in medicine. There's no regenerative solutions, but at least offered by traditional medicine, but there's a ton that are available.
Yeah. And you know, I've been seeing a lot on social media, like the Hims and the Hers and the Volt. Yeah. And I know a lot of them have like a medication, but there's a lot more to correct some of these issues than just a medication, right? There's a mental health component, right? Because psychologically, this affects people. It affects relationships. There's technologies that help both males and females with their sexual health. And then there are the medications like the different peptides and then also, the Viagras and Cialis that are out there. So talking about that, first part I want to talk about with it is the mental health component of it. Like when people come in, number one, they're taking their first step to come and talk to you about it. So it's you as a medical practitioner, we're not even treating anyone just yet. It's now you have to connect with them on more like a psychological, perspective. Let's talk about how that works and how you connect with these patients.
So I really think that for a lot of providers, because it isn't something that we're taught across the board with medical education. And again, a recent search of that, there's still no medical education related to sex. Nutrition too, there's other things, and even fitness. So a lot of that is like YouTube University, right?
Right.
But I think providers have got to be comfortable having those conversations. So that's number one. So I think it's the right fit provider for sexual wellness. And then the patients are looking for providers. But I think for our patients, they're coming in, they're either having hormonal, like systemic issues where it's energy or it's brain fog or low sex drive, or they're coming in for sexual wellness specifically with vaginal dryness or laxity, or orgasmic strength is a huge one for women. And so they're either coming for hormones, more of a systemic, overall, I don't feel well, or something specific to sexual function. And so it goes together. So if
Right.
you're coming in for hormones, we have intake forms that talk about sex. It's like, what kind of orgasms do you have? Why are you having sex? It's a great question, because you would think it's because of drive and
Right.
desire, but with women, they lose their sex drive. And so it's actually not drive sometimes. It's out of, I don't want to say obligation, because they're actually upset that they don't have a drive, but they're doing it for their partner.
Right.
And so those are important questions to ask, because again, if you don't have a drive, they're tearful about that. And when you talk about psychological components to this, so hysterectomy, for instance, so we have no issues, and we can get into hormone stuff with it, but we have no issues in a woman having vaginal bleeding, excessive vaginal bleeding during perimenopause. They're young and they're having a hysterectomy. But once they have a hysterectomy, even if they leave their ovaries in, they get decreased production of hormones.
Right.
Because the blood supply to the uterus and the ovaries are very tightly connected. And so if they lose their sex drive, they have like a 200% increase in the risk of depression or psychiatric issues related to mainly depression, just having an early hysterectomy.
Wow.
And
Wow.
it's all hormone related. So there's a huge component. I'm not sure that it is not the cause. So basically, if you treated the root cause, which is low sex drive or sexual dysfunction, you could correct the depression.
Yeah. And that's got to be very tough, especially in a relationship. Do you find that partners come together to talk to you about their sexual health issues, or typically is it individual?
So I think it's both. So we do a lot of partners. And it's interesting because we have like a No Man Left Behind, but it came out of like a partner that came together, so they came together. She came first, and then he didn't think he had issues. But again, once you hormonally optimize a woman, the sex drive changes significantly.
Right.
So now he's having trouble keeping up. So he comes in, we're having those conversations together, and it was just a, joke between the three of us about the No Man Left Behind.
Right.
But then it became on the intake form where they would refer other couples, and it was like,
Oh,
what
wow.
is this No Man Left Behind that you talk about? So we do a lot of partners.
That's awesome.
But, again, it's not just that the medical field won't talk about sex, but a lot of partners and a lot of relationships and marriages, they don't talk about sex either.
Right.
And so sometimes it's just opening those conversations with somebody else in the room. And so we almost call it like a small group therapy, because they both need to have those conversations, but they haven't had them in 20 years.
Right.
And now there's some issues that are prompting that. So
Yeah, and this allows them to open up and kind of rekindle things as well too throughout the process. Going to like talk about the male sexual health. there's a bit of confusion that a lot of people have when they think about sex drive, or let's put it like this, more of libido versus like erectile dysfunction, right? Decreased libido versus erectile dysfunction. So I want you to touch up on it because they're two whole different things, right? And I notice people, when they have those conversations, they'll kind of use them interchangeably, which they're not. So I want you to touch up on the difference between erectile dysfunction and then actual decreased libido.
So it's a great question, Sam, because that is, and it's a subtle point to some, but it's a huge difference, right? So when I talked about that systemic, symptoms, that libido is a systemic symptom. So meaning like overall, like whether it's, psychologically or just overall the man isn't having a sex drive any longer, which is it's the last thing they go for men, the first thing with women. So a man can have a very low testosterone, but more frequently they still have a sex drive, where a woman will lose that early on. So it's harder to get back with women than the first thing to go. Men, not quite the same, but obviously a low sex drive is abnormal for a man.
So would you say
it is, it's a good drive and it's a healthy drive, but the regeneration is local regeneration.
Okay.
So when you're talking about erection issues, which will happen with all men eventually, so if you don't start to regenerate early. So if you notice like you lose an erection one time, maybe it's somebody new, maybe it's with the same partner.
What do you mean by regenerate? Just to touch up on that.
So when you're talking about like erection issues versus drive, like drive is more a testosterone hormonal
base. Okay.
Yeah. So you have to optimize a testosterone most frequently with that. Where erection issues are usually a blood flow issue. 80% blood flow, 20% hormones. Age does matter. So if you're 30 and you come in with an erection issue, probably more likely to be a hormonal component.
Okay.
But as you get older, again, medical problems or age, and again, if you're not testosterone optimized, that does play a role in erections, but it's not the whole thing. So 80% of that's blood flow. So when you're talking about getting better blood flow and harder erections, you're talking about like an acoustic shock wave that's communicating with the tissue to tell it it's injured and get improved blood flow and sensitivity and orgasmic strength and erections, and then injections like PRP.
Would it be safe to say that libido is more the thought of sex, right?
Yeah, it's the drive.
It's the drive, the sex drive. So it's like, for the guys that are listening, it's when you're 18 or a teenager and you're always just like thinking about it and, you're out on the prowl, right? That's the drive that we're trying to get back for them.
Yeah.
And females also. So with the guys, the drive, and I'm just kind of repeating what you're saying here, it's probably more hormonal based. It's probably like a issue with your testosterone levels, which when you increase that, doing something like testosterone replacement therapy, the TRT, you'll probably start getting that sex drive back.
Correct.
Which I know I've met older men, that get their sex drive back. And sometimes it's a positive, and sometimes, it causes issues in the relationship because now they're a little bit too, thinking about it.
Yeah.
So with the erectile dysfunction, you said it's typically a blood flow issue. What causes some of these blood flow issues? Any kind of like chronic illnesses, cardiovascular issues, or?
Yeah. Well, obviously, any history of medical conditions such as high blood pressure, anything that's going to affect the blood vessel, high blood pressure, high cholesterol, diabetes, obesity, inactivity, smoking is a huge one. But then, again, those are the smallest blood vessels in the body. They're 1 to 2 millimeters. So the penile vascular flow is a barometer of overall vascular health.
Okay.
So if the penile vessels are 1 to 2 millimeters and the coronary is 3 to 4, the carotid's 5 to 6, so that's going to be the first blood vessel affected. So loss of a nocturnal erection, loss of morning erections, those are all signs that there's something going on with your blood flow. Or if you have trouble maintaining an erection,
that would fall under the category of erectile dysfunction also.
Yeah.
And that's something that people have to understand. It's not just not being able to get it up, but it's being able to maintain it through sexual intercourse as well, too.
I say like it has to be. So there's some obvious things, but it comes down to one general category. So you can have inconsistency. So you can get it, but maybe there's one or two times that they can't maintain or can't get an erection.
Right.
That's a first sign. Obviously, that plays a huge psychological component with men.
Oh, I bet.
Yeah, I mean, that's huge. And then like getting it but losing it. And people will talk about a venous leak versus, an arterial blood flow. Acoustic shockwave regenerative treatments are going to treat both.
Right.
They try to break that out into one versus the other, but the blood vessels, venous or arterial, are going to be regenerated. And then even loss of sensation. So prolonged like inability to have an orgasm is a form of erectile dysfunction, not premature ejaculation. That's a whole nother treatment. And
which I want to touch up on that in a little bit as well too.
Yeah, that's, but overall, the general category is if something is leading to sex not being satisfactory for the man, there's your answer. Like, that's not usual. So you don't have a drive to do it. You can't consistently get an erection. You're worried about getting an erection. You can't have an orgasm with sex. Anything that is interfering with your sexual satisfaction is erectile dysfunction when it comes to the penis and an erection.
In your professional opinion, a male, how long should they actually last during sexual intercourse?
So it's funny, we just did a recent podcast on the duration. And so there are lots of different studies. Do you know what, like women, so the average duration, I'm going to let you try and guess just to see, what do you think like the average duration of sex is?
So I was on Instagram the other day, and there was like one of these YouTubers that walk around the streets by the nightclubs and interview people. And he was asking females, like, how long do men typically last? And the average was seven minutes. So I'm going to go with 7 minutes.
So I think the average was 3.
3?
It was somewhere between 3 and 5. And so, but I think like 3.1. And maybe like the range was 3 to 5. Do you know what women wanted it to, how long women wanted it to last?
Shoot, tell me.
25 minutes. So
that's going to be tough for a lot of guys.
So on average, the women wanted it to last 25 minutes, and it was lasting 3 to 5 minutes.
Wow.
I think it brings up a couple points. In UK, it was interesting. The study was done out of Australia, but Australia wasn't one of the 5 countries studied, which is kind of odd. But UK was the longest at 10 minutes.
Oh, wow.
Yeah.
What are they? Yeah. What's in the water over there?
I don't know what they're doing over there, but they were the longest for sure. But it comes to the point that I think men are probably more focused in on duration. Obviously, the women were, they wanted it longer, but I think, and that was just penetrative sex. So it wasn't any foreplay with that. But I think what is more important, and I think women, as they get older, are probably more straightforward with it. But what men need to be aware of is the clitoris plays a huge role. That's the only function of the clitoris. It's a sexual organ. It has 7,000 nerve endings, more than the penis. And so without that stimulation, which again is on the outside, what you see is the glands of the clitoris, equivalent to the penis, but not as extending out as far.
Right.
But there's legs on both sides and around the vaginal canal. So that external stimulation and arousal is important. I think you can almost get a woman close to, orgasm, very close. Then penetration doesn't have to last that long, right? Because you've had those other, and a lot of women will say about 80% of women don't think they have G-spot orgasms.
Wow.
And so, but again, they're so closely related. Is it really, solely a G-spot, which is not technically a spot, but anyhow, it involves the clitoris too.
Yeah.
So that external component and arousal, then men wouldn't have to be as focused in on the penetrative sex or part of it. You don't have to last as long.
And this is something people have to kind of really think about here. You got the average of 5 minutes, and then women that want 25 to 30 minutes. Like, something has to be done. There has to be some kind of compromise. You got to work on something. So with men, with men, when we're talking about erectile dysfunction and the blood flow issue, most people are familiar with like the Cialis and the Viagra that's out there, and that works on the cardiovascular system to increase that blood flow. But one of the things that people have to also recognize is that it's kind of like a Band-Aid. It's not actually fixing the root cause of the blood flow issue, right? There's a lot of issues that can feed into the blood flow issue. So you mentioned something about the low frequency shockwave therapy. How does that actually correct that blood flow issue in males?
So I think whenever we're doing regeneration, and for men, that acoustic shock wave, however you want to call it, like, again, there's different companies that do it,
Right.
but that low, it's outside of the body acoustic wave communicating with the internal, vascular system. But it's basically every regenerative treatment is communicating some kind of injury pattern.
Right.
So you're communicating with the tissue, telling it it's injured, and then to repair. So all the growth factors that happen with repair. So I always explain to patients, especially when it comes to injectable or PRP treatments, but it's the same with acoustic shockwave. When you're communicating an injury, you have a cut to an arm, you have the platelets that go, they stop the bleeding,
Right.
and the platelets have growth factors
Growth
in them.
factors.
So first is your bleeding stops, and then those growth factors in the platelets, and if you are doing injectable PRP treatments, then you are getting a concentration of platelets, which have a bunch of growth factors that are now released to the tissue around the cut. They are communicating with the stem cells in the area.
Right.
Same thing is happening with acoustic shock wave. And then you have all those growth factors. You have regeneration. So those are vascular growth factors. Those are, soft tissue growth factors. But it's stem cells in the area. So you're going to regenerate penile tissue. And so again, better collagen elastin, fibrous linings,
Right.
vascular and nerve. So delayed ejaculation or decreased sensitivity is treated with acoustic shockwave, but it's all an injury pattern.
And you
And the
you do
simplistic
it alongside with like the P shot and the exosomes that are out there.
Yeah.
Yeah.
So I think that always pairing, I love to do, again, that communication with the overall tissue. So like an acoustic shock wave, whatever, device or, different places call it different things, but just finding an office that you trust, right?
Yeah.
That is reputable and that you trust, that it's communicating with the overall tissue when you're doing it everywhere, because you're doing that over the penis, into the scrotum, or into the perineum, not the scrotum, because that would be painful. And then you are dumping a bunch of growth factors in after. So
Right.
pairing that. So even if they're doing a series of gains wave or acoustic shock wave, whatever you want to call it, you're doing the series, because most men will need a series, but again,
Right.
there's scoring systems that you can evaluate the erectile dysfunction going on.
That's the shim score.
The shim score, yeah. And so that gives you a number, and that's 5 to 25. So if, you're 25, and just think 25 being you're 25, and no issues whatsoever.
Right.
Or 5, you've had a prostate surgery, nerve injury potentially. Is it coming back or not? But hardly have any or no function. You want to get to the 20s. So usually a series of something, and that can be exosomes, an injection of PRP. But I think that when people ask about PRP versus exosomes, you're really taking your growth factors with PRP.
Right.
So somebody is hesitant to add young, healthy growth factors. But the further advanced you are with erectile changes, the better it
Yeah.
is to add exosomes to it.
I love this because this is like we're focused on correcting the root cause.
Yeah.
Where sometimes you correct it and you don't even need some of these medications that are out there.
Yeah.
Now, so Cialis Viagra works on the cardiovascular system. Now, there's a peptide that has become very popular, the PT141, which works both on males and females. Now, that works on the central nervous system, right? So that, we just hear people talk about that like it is the best thing since sliced bread.
Yeah. Yeah.
Give us like some graphic details of like what it really does and what your patients are saying about the PT141.
I say everyone loves PT141, but when are they going to love it? Because the orgasmic strength is incredible. So that's the feedback, right? For both men and women, because they can both use it. And I think when you bring up all the different things that you're bringing up, what you're pointing out is that it has to be a comprehensive treatment because
Right.
it is multifactorial for sure. So there's a psychological component. So if you're hitting it with a peptide that works neurologically, it's the melanocortin system.
Okay.
You know, so it's a whole different system. But if a guy has that confidence issue because he's had some erection issues, you're regenerating, you want to give him that confidence back,
Right.
then they can get erections spontaneously. So at first I'm thinking, do we really want them to have spontaneous erections? But it has not been an issue. I have not heard any feedback about, so I still think, you know, that stimulation, but then they're more confident that they'll get the erection when they want it.
Right.
But everyone loves it. Like
Yeah.
orgasmic strength is incredible, but erectile dysfunction and like ED is huge. So just better erections, not just orgasmic strength. But when are they going to love it? Because they get a little nauseated, maybe. Some
Initially,
timing.
right.
Does it work at 30 minutes or is it 5 hours? So you got to find your timing. So I don't recommend it on, you know, your honeymoon the first time because
Right.
you might get nauseated, be vomiting, or
Yeah.
you got to
Get
have your
that
timing
flush.
right. Yeah,
Right.
but everyone loves it. Like I have patients rave about PT.
Now, PT-141, that was actually FDA approved for females, for female.
Valesi,
Yeah.
Valesi, whichever.
It was
yeah.
like for female hyposexual desire, and it
yeah.
gets them going.
Yeah.
So now how does it
think
work on
it's-
females versus males? Obviously, with males, it gets them erect. With females, what are they experiencing?
So, do you think, before we get to that, do you think it's interesting that we actually have a peptide approved by the FDA for hypoactive sexual desire disorder for women, but we don't have testosterone yet approved?
That's crazy.
Yeah,
It's
yeah.
crazy when you think about it.
It's
Yeah.
crazy. Like, so women need testosterone, most circulating hormone in their bodies too. And so people are amazed by that. You know, it's 10 times higher than estrogen in a female. Just estrogen is the dominant hormone for a woman. And again, both men and women have both of those.
Right.
Men just have a higher, 10 times higher than women do of testosterone, and we have higher estrogen than men. But both of those need to be optimized. We don't have a testosterone approved FDA product for women. So, you know, whether you're using pellets or testosterone injections, you know, when you're talking about creams, that's a compounded, which is a whole nother topic.
Right.
And so that's how you would optimize, but we have PT-141. So it's a one dose, one injectable, which again also doesn't allow you to titrate that.
Right.
Because you don't need a one dose for everyone. And that's the problem with manufactured and conventional, you know,
Yeah.
medications, right, that are FDA approved. It's usually a one size fits all. You can't customize. But it works the same way, you know, so it's a neurologic, better orgasmic strength for women.
Wow.
Too. And so again, but women are just like men. It's a comprehensive, it's multifactorial.
There's
You gotta hit
hormonal,
it from-
psychological, there's all of
You gotta hit
that.
it from all
Yeah.
the different angles and address everything.
Now I
And
do
this
know
goes into-
with males, there's other things that contribute to sexual health issues. There's Peronis disease, which there's a lot of guys that walk around and they just think, okay, well, I have my penis walks around with a curve. It's okay, and they don't understand that there's some issues there. There's some plaque that's been built up, and let's talk a little bit about Peronis, and I know some of the shockwave can help with that as well too. I'll let you kind of go deep as the medical expert on that.
So Peronis, again, there's a curvature, so there's a scar tissue, and a lot of men, there's no recall of what happened. So was it a Foley placement, you know, a simple outpatient procedure? Was it, you know, an injury during sex? A lot of men can't actually report what happened, but they start to notice a curvature. So wherever you're curving is where the scar tissue is. So it's just
Right.
contracting down and you get curvature in that direction.
Does it get worse over time?
Progressive with time, and then pain, and also ED, you know, with
Wow.
that. And it's actually painful for the partner too. So
Yeah.
it's pain for both, and it is progressive.
Especially if it's hitting certain areas of,
Yeah.
you know, that it shouldn't be hitting, you know?
And even the progressive part is interesting because patients, you know, well, you know, how many treatments do I need to do for Peronis or ED? You know, is it a one-time, you know, injection? Is it a one-time gains wave? And I'm sure you know, kind of hear this occasionally. And it's like there is a no one-time, you know, one and done in life, period.
Right.
You know, and the one thing that is a guarantee is it is progressive with time.
Yeah.
So erectile changes are progressive with time. And 100% of men at 80 have erectile, and it's 50 at 50, 60 at 60, 70% at 70. So it's progressive, and Peronis is the same.
Right.
So that curvature happens, and the best way to treat that is with acoustic shock wave communication to get realigning of the scar tissue, which is collagen, and injecting PRP into that area too, because your other options that include, traditional options
Right.
are, again, a collagen breakdown injectable, which actually can set you up for a potential fracture of the penis
wow.
because that scar is now weaker.
Oh,
And
boy.
surgery, which isn't, could be.
no one's looking for
no one's
surgery.
looking for surgery.
Especially
it
down
can
there.
be shorter, but vacuum erection devices are great with all of these
Right.
treatments because that's your home. Like we have our part in it, but the patient has their part in it. So getting healthy and being active, it's multifactorial.
Right.
Getting active, not smoking any longer, just all the things that you can do.
Yeah.
But also vacuum erection devices are part of it because it's going to pull blood flow in and stretch that
And that's
tissue
part of the
out.
protocol too. So for the men that are listening, and we just started talking about this curvature, right? There's going to be quite a few men that are listening to this podcast where they're going to go walk into the bathroom after listening to the podcast. It's like, man, my penis curves to the left, to the right, up, down, something. What do you recommend if they hear this podcast and they're like, I never knew I had Peronis. What's the first step at that point?
I think being evaluated, if you're really concerned, I think it's something that they do pick up and recognize. And I think most are probably looking at and can get enough information online. But if there's a curvature that's starting to be very obvious,
Right.
I think that you need to at least have that looked at. But when you talk to the urologist, again, there's very standard, but only a couple options there, and none of them are good.
Wow.
So I think you have to start looking, and this is where patients are more proactive than providers in medicine in this. They're looking for solutions that
Yeah.
are that aren't traditional. They're looking for something that doesn't involve a surgery. And regeneration doesn't have side effects that come with it.
Yeah.
But there is an investment in time and money and just educating on that because there's a commitment on the patient's part and on our part.
Education's
Yeah.
key. Like people just have to know first.
Yeah.
So, well, one of the things that I actually got this question the other day from a patient, and their ask from us was, "I want to perform like a porn star." And the first thing I said is, "Well, listen, this is like me watching a Superman movie and say, hey, I want to fly.' Like it's a movie, right? You want to be like a porn star. We can help you try to get there. But at the same time, when you're watching these pornographic movies, like, there's different scenes. They cut it, they turn it off. There's a stunt guy that comes in, they're zooming up. Is it realistic for guys to be able to perform like how some of these people do on TV?
Oh, God, that's a great question. And I guess a very diverse answer could be the answer because I guess it depends on what kind of porn they're watching too. Like if you're watching like erotic porn or sensual, like you probably are more about the clitoris and the external and getting the woman aroused than just the penis.
Like they want to
And
go.
there's-
Like the guys that talk to us, like I want to last for an hour. I want to just keep on going. And it's like, we're talking about erectile dysfunction. We're talking about libido, but at the same time, there's another part that we're
Yeah.
just started talking about, which is the performance.
Yeah.
Where we have guys that come in that don't have erectile dysfunction, don't have decreased libido, but they just want to perform. They want to be last longer. They want to be thicker. They want to be longer. And a lot of the things that we're talking about will help these gentlemen.
So I think, again, it's what they want and what they desire, which is why the answer would be, what are they watching? What do they want from that? So if that's lasting forever, it's not that these procedures won't give that 20-year-old, that ability to have a harder erection or, again, girth max type procedures, where you're injecting filler and making them larger. It depends on what they want. And I think if it's important to the patient or the woman or the man, then having those conversations, seeing what they desire, and if it's important to them, then it's important to us too to try and get them there.
Yeah. Do you do those procedures? The filler?
The filler, yeah.
How is that? I haven't heard much about the filler. Does it actually work?
It works, yeah. It's actually quite addictive. I think most men like once they do it. It's a girth. There's no way to really make a penis longer. Potentially, maybe a pump, and there's a specific.
There's like traction devices I've seen out there too.
There's PE, where they're doing, home, stretching, devices.
How many extra inches do you think a guy can get from the penis pump and or the traction device?
So I think you're going to see more about that on almost forums.
Okay.
And we did a recent podcast on this, even just talking about, because we had not heard of the PE. And again, it's probably because I have a female office and it's we don't have the equipment, right? And so we're not hearing it from internal, discussions. But we got on forums and just saw, and there's a lot of patients that actually report, a lot of men that report an enlargement. Girth is already a known thing with the vacuum erection devices. Length, maybe not. But they do report it, and they'll have the traction devices and the vacuum erection devices that they're using and they have specific models they like, but they do report it. I don't advertise lengthening in any way, shape, or form from my office because I can't promise them that. And I want to be very transparent and realistic.
Realistic, right.
And that's why I think it's talking to the man, and if it's important to him, then it's important to us to be just realistic. Can we get you that or can we not? But the filler procedures are great.
How much girth can men actually get from something like this?
Well, you're not going to do more than a little bit at a time. I shouldn't say a little bit. I'll put up to 3 syringes on one side and then the other. You might get some lumps and bumps when you're doing that amount, but I do have a lot of men that will travel in because they can't get that anywhere.
Oh, wow.
But it's a matter of that working its way out, and they love it and they want more, and so then you can repeat that. But
what are the potential side effects of doing the filler?
And you're not going as deep as the corpus cavernosum, so you're really just going into the layer in between the fascia. So it's not going to affect erections. If you got blood, you're too deep. So you would be rerouting. So definitely you want that provider that knows how to do it and is reputable with it. But lumps and bumps are the biggest thing. Just making sure those smooth out. There's certain things you don't want to do right after, like anal sex would be one of them.
Right.
Anything too tight that's going to affect the filler, for a good.
So I would assume when the penis is flaccid, it's probably going to look a little awkward. With the filler.
Until it smooths out.
Until it smooths out. Yeah. And how long does that filler typically last?
So when you're in a system like that, but that is a used system, meaning that that's inactive. So if you put filler in tissue that's moving, then sometimes you'll get, that to dissipate a little bit quicker. But usually you're talking about a year and somebody's
a year. Okay.
Again. Yeah.
It's not bad.
Yeah.
Right.
But most will come back before that to do it. And I don't actually advertise it. So they're usually finding because we'll have something that we have done before on it, but they'll look in all of Tennessee and can't find a provider doing it, and then they end up in our office. Yeah.
So you were talking about the different vacuum devices. Mm-hmm. I'm familiar with there's one called the Kaplan device, and has pretty good ratings and stuff. Is there a type of device that you typically recommend? Do you recommend more of the manual device, electrical, battery operated ones? What's your recommendation?
So we use the Kaplan. It's actually termed the Whopper, because it has 2 cylinders. So the first cylinder,
the Whopper, is that like the hamburger Whopper?
Yeah, it's the Whopper. It's actually a funny name, but it has 2 cylinders with that one, and that's the one that potentially might get you length. The first cylinder is based on penis size, so it's small, medium, and large. So that same length, it's just a different girth.
Right.
And then the second cylinder is larger. You're supposed to put the scrotum in it as well. And so then you have the suspensory ligament in there.
Oh,
so
wow.
it potentially could get lengthening. And again, it's not something that I'll advertise as a solid, result of pumping or using in the vacuum erection devices, because I think that's more of a male reported thing than I've actually seen in practice. And when we're doing regenerative treatments, I don't also report that you're going to get increased length. I just think you get harder erections and therefore length back.
Right.
But men report, increased girth and potentially increased length. But we use the Kaplan.
Now,
And so that's the one that we prefer to use, and it's manual, not electric.
it's the manual. Yeah. And we recommend that to a lot of our patients that come into our sexual health division. Now, for the people that are listening here, it's not just one thing. And you've mentioned that multiple times on this podcast is, there's multiple things that have to be taken in consideration between hormones, doing the shock wave, doing the vacuum. All of these things play a part. And, even with the vacuum pump, there's part of it, you have to do it X amount of times a week. And then post that.
A day when you're
a day, okay.
Yeah, usually we'll recommend 10 minutes twice a day.
Twice a day.
Yeah.
Wow.
For regeneration or active sex, but if they can't have
So you got to
sex,
bring your little thing to work and bring it
Yeah,
with.
twice a day. Yeah, it's just like pumping for breast milk, right? Yeah. Same thing.
What are you doing in the bathroom there?
I know.
People are knocking at the door at work.
Rooms for them, right?
Yeah. And then I've seen that there's like a ring also to hold the blood after your pump. What's the purpose of that?
So with the ring, you could potentially have sex. So a guy with that SHIM score range,
Okay.
more in the lower end of the range, could put that ring on, pump up, and then leave the ring on, which constricts and leaves the blood flow in. And actually,
Is there a
used-
technical name for that ring besides calling it a cock ring?
Yeah, it's really, that's
Yeah.
pretty much
Basically it. Yeah.
the official term for it. And but no, that is something that they can do, and actually, that's used for prostate rehabilitation after
really?
surgery, or I should say, like erection rehabilitation, but penis rehabilitation after a prostate surgery, because in the partners actually and the patients report a significant satisfaction with that.
Oh, really?
Because they have to, your prostate doesn't have a capsule. And so frequently the nerve can be affected with the surgery, and it's robotic surgery that's done. But if it's affected, is it just an inflammation? Is it something that's more severe? Is it a damage? And so rehabilitation is a normal part of that. And vacuum erection devices are huge for that.
Awesome. So I think we got the whole male stuff down. I mean, there's a lot. And, obviously we can't give everybody all of the information because everyone's a little bit different. And for any males or any medical practitioners that are treating males, we're here to provide you with more information. Reach out. But now I want to go into more of the females, right? Because I think people talk a lot about like male erectile dysfunction, sexual health, and sometimes we forget about the females. And there's a lot of different procedures out there that are very beneficial for females, especially females that have have multiple kids, and there's correct me if I'm wrong, prolapse uterus issues. There's pelvic floor issues. Females that have had endometriosis, that have scar tissue. So vaginal dryness. So where do we start with the females?
This sounds like a huge one because it's, again, I think that there's such a gap in medicine for sexual wellness across the board for both men and women because the traditional offerings are very limited. So you're talking about your Band-Aids, the Cialis, Viagra. You're talking about potentially injections after that, right? And then maybe even penile implants for men. So there's already a huge gap because there's a lot of regeneration that we've already talked about that you can do that you don't hear about, but patients are more proactive. So that's a huge gap for men and for women. But women have been left in the dark for a long time. So we have low T clinics, right, for men. We have no low T clinics for
the women.
Or so for men, but nothing for the women, right? But it is the most circulating abundant hormone in their body. So I think we're starting to talk more about estrogen and progesterone and the WHI study being way behind. And again, huge, miscommunication and media hysteria way back in 2002. And women have been taken off hormones since then and have been suffering symptoms since then. That's systemic again. That's that whole body, like brain fog, energy, low libido. It's affecting sex. It's affecting marriages.
Right.
And then we get to the whole sexual dysfunction. Because as a woman hits, 40 to 55, I say that's the perimenopause, with 51 being the average age for menopause, that we have a lot of symptoms, but we're placed on medications now because they took hormones away, which again, they didn't have to, but even physicians aren't yet prescribing that as much for women.
Right.
And we have no FDA approved products for, testosterone, but we do for estrogen and progesterone. But again, compounded stuff fit the bill a lot better because you can customize those. But when we come to sexual regeneration, it's even more ridiculous. Again,
Right.
they have no sex drive, which all the sexual dysfunction that happens with low sex drive, vaginal dryness, the things that you've mentioned, orgasmic strength decreases. You have arousal issues. You have urinary incontinence. They've had vaginal deliveries, and then there's brain fog and energy and sleep, and all those things also affect how a woman functions sexually, right? So women across the board, there's about a 50%, almost 50% sexual dysfunction in menopause, but that happens a lot earlier, and especially if we're not doing hormones and we're doing hysterectomies and we're not explaining to them that their hormones must shut down and they're going to get depressions and anxiety, so that we put them on antidepressants, anti-anxieties, and sleep medicine. But regeneration is huge for them. We just don't do acoustic shockwave as much. We do laser vaginal rejuvenation, and it can be done internally. Again, communication pattern with the tissue just to regenerate nerves and blood vessels, so better orgasmic strength. You get all the functional improvements.
Right.
You get better blood flow, better orgasmic strength, tightening. So it's something that also, might be beneficial to the partner. And so you have all of that improvement in incontinence. That's the regeneration part, but optimizing them hormonally so that the tissue responds is important.
Of course.
So usually it's laser internal, and then we do external stuff too that tightens and can transform just the look externally. Because, that the vagina takes a beating over time, right?
Yeah. So, Dr. Durst, how young are you seeing some of these females coming in with sexual health issues?
So again, that's a loaded question because things change with time. Like, it is changed. And I think when I opened my practice in 2019 at the current location, that women really had to be almost convinced of, like, they would have all the complaints, but almost convinced of worth in doing treatments where men would come ready to do them. But that has completely switched. So we see a lot more women now than even men.
Okay.
But what's interesting is the younger women now, even having questions about what looks normal. Like, I think it's a social media thing where it's almost an insecurity that's instilled.
Like, when you say young, like what age?
Like
are we
in the
talking?
20s.
In the
Yeah.
20s.
I have multiple staff alone. We're sitting there having a conversation, looking at a before and after of like a vaginal external treatment we do called the 4V. We're taking a picture, we're looking at, and I have 3 staff in their 20s sitting there like almost red-faced, wanting to ask questions because they feel like this wasn't normal for them or this. I was like, what are you possibly talking about? You're in your 20s. I'm sure it's all normal. And it was. It's just knowing the anatomy and knowing that the labia majora and the minora, and you're going to see that. So I don't know if it's a social media thing
Well, now
and instilling insecurity.
Yeah, in social media, I'm starting to notice a lot of these plastic surgeons are promoting the labiaplasty, right? Where they're cutting off the lips and it's giving it a different look. So do you think that a lot of these younger females that haven't had that procedure are thinking, hey, this is what I'm supposed to look like, and now it's causing some kind of insecurity with them? Yeah.
No, I think they need education. That's first, is education that it's normal. Like, every vagina looks different. It's just like a fingerprint. It's just like lips. Every single vagina looks different. But it's not abnormal.
Right.
I mean, it's very rare for that to be an abnormal needing surgery. But most of the time, there's been a gynecologist along the way that has told you that you have excess labia, that would require surgery. It's only when you have excess tissue or maybe an adhesion and the clitoral hood is adhesed to the clitoris that's interfering with sexual function. But other than that, most of it is normal. But
Right.
labiaplasty has increased, which is why I say it has changed over time. Over the last 5 years, has increased by 75%.
Oh, wow.
One plastic surgeon with a recent conference, it was Cosmetic Gynecology Conference in Miami, just recently had reported in 100, and it was an international conference, 150% increase in his practice.
Wow.
And when he asked why he thought that was, he thought that it was because not enough people are doing the surgery. I think it's because of an insecurity we're instilling in our young women on social media. I don't know who's instilling it, but it's amazing to me that I had 3 20-year-olds in my office alone asking about what was normal.
Questioning
So
it,
that's
right.
what prompted me, and that was before the conference. So I think most don't need surgery. We do have lasers that treat that, and we have multiple lasers that treat internal and external. One of them does an amazing transformation externally. So anything that is normal but bothersome, again, if it's important to the patient, then it should be important to us.
I would only assume that if, you know, there's too much down there for the female, it could cause potential painful intercourse, right? This is just an assumption on my end because I'm not too familiar with the sexual health medical side with the females. Is that a lot of them are probably seeking these type of procedures even with the laser because of painful intercourse, maybe? No?
No, most of them young are actually, so I think the ones that have had painful intercourse have probably already seen their gynecologist for that and have been told
Okay.
that they have excess tissue of some sort.
Right.
And so, but that's not usually it's something really minor that's bothering them. And sometimes it's women like going through a bad relationship. Like, again, sex isn't happening and now they want it more than the man does. And they're starting to just question. So I feel like most of it's just minor things that they want to see, but in their mind, it's very big. And so I tell them, if I look at you and do an exam and I say you're nothing special, it's actually a good thing. Because
Okay.
what I'm saying is really like you don't have anything that can't be treated non-surgically. You don't need a labiaplasty. We have that joke with patients because they're actually feeling very insecure. Even prolapse, which you talked about, we've had at least one lady who loved hiking. And she absolutely loved hiking, was giving it up because her gynecologist had scared her. She thought her uterus was going to fall out when she was hiking because she had prolapse. That is actually not uncommon either. There's probably very
What usually
few.
causes that?
It's just vaginal deliveries most of the time, hormonal changes. And so you really just get a weakening of one of the walls of the vaginal canal.
And to break it down for the people who don't know what a prolapse uterus is, like what is it? What's happening?
So what you're talking about really is a prolapse of something. It can be a rectal prolapse. So like the vaginal canal is long and the cervix is at the end. In the front, you have the bladder, and the bladder can actually prolapse into the uterus or into the vaginal canal. You can have a uterus prolapse or you can have a rectal. What that is just weakening of the vaginal wall tissue, which is pretty normal after vaginal deliveries or hormonal changes as they're getting older. So there's very few women that you're not going to do a pelvic exam on, bring the speculum out, and see some kind of collapsing of the vaginal wall as you're bringing it out. But I think if we started to do vaginal laser treatments internally in between children, we actually probably would never progress to have that as we hit perimenopause and menopause. But vaginal treatments are going to tighten most of that up.
Are
So
there
it's
any
only when it's
exercises
severe.
that help with that as well too?
Well, Kegels are like something they talk about with incontinence. And so,
Right.
the pelvic floor also weakens. And there's even an EMS treatment that you can do that tightens up the pelvic floor too. But Kegels, everyone talks about that. If they truly worked, we would have no women with incontinence. But we have a significant problem
Right,
with incontinence with women as we hit perimenopause and menopause. But it's actually quite common with young girls too. So
Right.
it's something we're seeing and hearing a lot more in our young women as well.
So when we talk about vaginal rejuvenation, it helps tighten the vaginal area as well too?
Yeah. So if you're looking at the vaginal canal, so like the vaginal canal is long, and again that lengthens during sex. There's different things that happen, but if you think as we get older, it's really like an accordion that turns into a PVC pipe eventually.
Oh wow.
When you have hormonal decline.
Right.
You know, it's almost like the equivalent again of the man in the corpus cavernosum that has the blood flow being a sponge. If you leave the sponge out of the package and it's dried up and not healthy, it's hard, right?
Right.
You take it new out of the package, it's nice and spongy. So that's where you're trying to like regenerate that tissue to be healthy
Right.
and have lots of blood flow. For women, you want that vaginal canal to be healthy again. So if you do the laser internally, and we have multiple different ones, most of those are just heating externally.
Okay.
So you're penetrating the vaginal canal, but it's just a surface heating. And again, a communication pattern of injury to improve blood flow. And blood flow is lubrication. So vaginal pain, vaginal dryness, but increased nerve regeneration. So sensitivity, increased orgasmic strength. You can focus in on the anterior vaginal wall. And we discussed that that's the bladder, the space in between the urethra and the bladder, and get support of that again, because
Right.
that's something that weakens over time with vaginal deliveries and hormonal changes in age. But so you get functional improvement of all of that when you're doing a laser and diffusely heating, and then you're dumping in growth factors when you're doing a PRP or an O shot
Right.
or an injectable along with that. So pairing those, you're having like an exponential communication of injury with the tissue for repair. It's just a different repair.
I tell you
for
that
women.
the science and technology has come so far, and for the guys that are out here listening about vaginal rejuvenation for your significant other, you know, when you're telling the labor and delivery doctor, hey, put a few extra stitches, that's not gonna fix it. What we're talking about here is what's going to actually get the results of what these guys are looking for with their significant
Correct.
other. So,
And we go without even telling women there's any potential.
right.
It is, you have vaginal deliveries of a huge baby through a very small tissue. Obviously, it's expansive and it will, it's elastic, it's going to, come back to, but not ever to the same degree. But there are things you can do to communicate with that tissue. And so even if we're talking about injections for men or, again, Cialis Viagra, you can do that for women too. It increases blood flow, increases that nitric oxide production, and then having, a supplement that also helps you with a specific pathway that might, again, break down after we start to age. That
Right.
can happen with women too, and blood flow is needed for arousal
Yeah.
and lubrication. So, but we don't talk about that with women. And now when we do videos, we still get questions about, can women use that too? So women, there's no gynecologist prescribing a Viagra Cialis for women, and there's low doses of them. There's low dose combinations you can do for
Right.
those for men and for women that help and work and but the regeneration, even incontinence being, again, about 50% of women as they get older, the only American Urologic Society and the NIH and recent guidelines in 2023 still only included medications and surgery. We're talking about Botox injections into like the bladder wall. Like not good options.
Right.
And then medications that help with incontinence when we can regenerate without any side effects. And there's studies to support the safety
Right,
of lasers, but there's not one regenerative treatment recommended per those societies as of 2023. So there's just a lot of work we need to do to close that gap in medicine for both men and for women.
Now, Dr. Durst, I've heard of, and this is, I've heard about this stuff, that the technology for vaginal rejuvenation is so good that there's even young women that, in their 20s that are part of certain religion groups and stuff, that they're not supposed to have sex before marriage, that they go through these procedures before getting married, and their husbands have no clue, and they think they're a virgin from how good the technology works. I don't know if you've heard anything like that
I
before.
hadn't heard that, but
Yeah.
I don't doubt it. Like, again, tightening is one of those.
Yeah.
And I've had at least one husband, and it wasn't in a bad way. We just have conversations. We just have open conversations. And he was in for something, and he's like, oh, my wife can do vaginal rejuvenation and be tighter. Oh, I'm going to like schedule her an appointment. But we know her too. Like, so it wasn't, and she was all for it. So it's a matter of like having communication
Yeah.
issues. No doubt. I don't doubt that they can get that because it does tighten.
It does. Right. Right.
And then
So-
you can also have, like, we have that surface heating, but you also, there's another one where you're penetrating needles with the surface heating. So it's like a radio frequency microneedling that you can do. It sounds painful, like if you do Morpheus on the face or a radio frequency microneedling
Right.
on the face, you can do that vaginally. And it's actually more painful when you do it on the face than it is vaginally.
Oh, really?
You know, we have techniques where we're numbing, but I really think that tissue is meant more for a blunt force than it is for a penetrative, needle sharp force.
Right.
So they actually do quite well with that. But if they have more severe urinary incontinence or orgasmic stuff that we might want to address, then you're just driving the energy deeper into the tissue.
How many sessions would you say to actually get to the desired result? How many sessions typically do women
So
go
typically
through?
across the board, you're almost looking at 3. Again, laser treatments a month apart with a PRP or a
Okay.
shot added in. But we'll do FSFI scoring systems. There's also an incontinence scoring too that you can do. So that's at least a starting point if they are older, have hormonal changes, vaginal delivery, already starting to have symptoms. More severe symptoms may need more.
Okay.
So we'll kind of lay out a treatment plan at the beginning with women and then go from there and assess. But we usually will say, again, if we recommend a series and an O shot, if you choose something different, because we're going to support you in whatever choice you make. But
Right.
if you're not happy with the results, there's probably a reason for it. Because
Right.
there's a recommended treatment plan aesthetically, for everything.
For everything.
Right?
Everything that you
And
do, yeah.
so if we put somebody medically on high blood pressure medicine and traditional medicine, but they don't stop smoking, they don't, work out, they don't lose weight, and we're surprised that their blood pressure is still high and we're going up on it, it was a treatment plan.
Right.
And one party did their part and the other party didn't. So I like to just be transparent
Yeah.
with people. What I think what I think is going to be needed to get the results, because that's really what we're going for.
Right. Right.
And, we have a lot of experience with that. But you can do external stuff.
Yeah.
Just so like there is, and that's not such a normal thing. And we used to do it with one of our surface lasers, but now, again, we started doing almost a vaginal facelift with a laser.
Oh, wow.
Because we do a non-surgical facelift with the laser on the face, and now applied that protocol to the vaginal area with transformative results. So
Wow.
most women don't need cutting unless if you
They can do it with the
told.
lasers, right?
Yeah.
So what about vaginal dryness? I know that there's a lot of things that can affect that, even in younger women. Medications that they're on, or whatever it is. What type of procedures are you doing to help with bringing moisture back?
It's still the same because those lasers are going to functionally treat everything.
Okay.
So like your injury is nerves, which orgasmic strength, collagen elastin, tighter, more elastic, but also blood and blood vessel regeneration. So dryness in lubrication is a function of blood flow. So the
Okay.
better blood flow you have, the more regeneration, the better blood flow, the more lubrication you have. So even with breast cancer patients that might not be able to get hormones, vaginal laser rejuvenation is not contraindicated with that. So they can still get improvement. And you can also still do vaginal estrogens that aren't estradiol that can also improve vaginal health and are great because frequent urinary tract infections also happen. We have a very short urethra. If
Right.
things aren't healthy down there, and post breast cancer and treatment, vaginal dryness is very common. But you can actually use some estrogen that is an estradiol that isn't going to raise your estrogen in your bloodstream and get some rejuvenation. And I think hormones is a huge part for women. We have done a huge disservice for women
Right.
in the U.S., but actually, worldwide, we're just starting to address that misinformation from 2002, but it's still very weak. I think that as soon as we think we make progress, we'll have an opinion piece that pops up in a very reputable medical journal that is doubling down on that same. Those were synthetic hormones. We use bioidentical. Compounding pharmacies aren't bad. It's more customized. It's filled a gap in medicine for a long time.
Yeah.
And so as long as you have a hormone specialist or a provider that is treating the right way and following, again, everything should not be insurance based,
Right.
Because you don't want insurance companies dictating your care.
Yeah, you definitely don't want that. So,
And you also don't want physicians to be, their care is dictated by insurance companies.
right.
I mean,
That's
do
scary.
you really want an insurance company to dictate the kind of care you get?
I don't.
Yeah, correct. So some things are going to have
Right.
to be, it's like the leased car.
Yeah.
You go and you lease a car versus buying an older one because you're going to have things that are covered by a lease. You don't want the major expenses. Insurance there for the major expenses, but things that actually make you feel better. You still have to replace tires and brakes because everyone has them go bad.
Right.
And you have to have them to drive. So it's the same thing with cash-based medical procedures. I think people are attached to the fact that something has to be from an insurance company and approved and by a traditional doctor, but we're way far behind in medicine.
Yeah.
And we probably won't even see that change in our lifetime.
Yeah, which
So,
is scary.
unfortunately.
I think that one of the most important things is for the person that's seeking some of this help for sexual health is finding a medical practitioner like yourself that's really dialed in, with a lot of these alternative treatments that really work, that are, in my opinion, more of the definitive treatment on fixing what the root cause is.
Yeah.
Yeah.
I mean, you want to get to the root cause.
Yeah.
And again, it is multifactorial. It has to be comprehensive. So if somebody throws like an acoustic shockwave in an office, I've had tons of, patients that come in. I've had that. It didn't work. But if you're not comprehensively addressing it, and, again, you think you know what might get the results, but if it's more severe, you don't respond, you're not doing your part, just assessing and then further, adjusting as you need to, but you got to be comprehensive.
Yeah.
And there has to be a commitment both ways, but I think there also has to be a fit.
Yeah.
Like the patient has to be a fit for the provider or office, and not every patient's a fit for my practice.
That's true.
But I'm not a fit for everyone else either. So, and that's okay. Like, that's okay. I think we're going to all attract the right one, but if, like, the right fit. But I think if patients are empowered and they can make a difference and they can do it without traditional meds and surgery, they should do it. Like,
I agree.
I would educate and empower them to make those decisions and not wait for an insurance company to tell them.
Make the investment
Yes.
into your own health, your sexual health. Don't wait for the insurance companies to do it. And take that deep dive, take that deep dive and, you'll see the positive side from it.
Yeah. I mean, we only have one body.
Right.
So again, fitness and nutrition is not a medicine-based thing. We don't do a good job with that either. We don't do a good job with sex. We don't do a good job of talking about it, but we only have one body. We have relationships that determines our joy in life. And so, you got to take care of it. If we didn't know there was house maintenance and we have a house that's 80 years old and we're just finding out, there's a lot of maintenance.
A lot.
So the sooner you notice changes, the quicker you get on things, the healthier you keep.
Be proactive about it.
Be proactive, yeah.
The
So-
experts are out here. You're here.
yeah.
You're talking on it. Is there anything else that you would like to touch up on when it comes to sexual health with the females or, any of that?
I think the biggest thing for me, so when I opened my practice and the new location was in 2019, and again, it was just me going through things. And, we talked before the podcast a long time in the ER, just noticing changes. And then you go to a first anti-aging, you realize that there's all kinds of solutions, but you don't know about them.
Right.
And as a medical traditional trained doctor, I knew nothing about it. So as I'm starting to do it and feel better and you bring it into practice, when I opened the practice, the sexual wellness piece is the part that took off immediately. The second is women's health. So if I was to say anything, women have been so left behind.
Yeah.
Like, we're talking about nothing approved for really getting at the root cause for women. But there are a ton of safe procedures, hormones being one of them, going to a hormone specialist, readdressing the fact that, yes, estrogen is good. We're doing bioidentical. Yeah, it might be compounding. We don't need to do the fear tactics we've been doing since 2002 with women, but we need to add testosterone onto that too and optimize them, because they don't need to be on anti-anxiety, antidepressants, sleep medicine, a peptide injectable first. We can optimize their hormones, including testosterone, and get them active and healthy. And then obviously peptides are part of it. But I think women just need to know that they're going to have to make those decisions and learn it, because every single day, all day long, it's patient after patient. And we see a lot more women now just because of the change over the last 5 years, because they're online. They see their solutions and they're not hearing about it and they're not happy.
Yeah.
So I think the more providers we can get doing this, the more, that your book talks about it. There's a gap. There's a lot of providers that want to get out of traditional medicine, are very unhappy and don't really know how to do that, right? But there are a lot of patients for looking for procedures that aren't traditional. And so there's a huge opportunity for them right there.
And Dr. Durst, I really appreciate what you've done and some of the stuff you're saying here. And one of the things that I want to make sure that these medical providers that are listening in right now is they have to put in the effort themselves and learn about female sexual health, about female hormones. And one thing that I've noticed is there medical providers who get into this industry, more of the age management or functional medicine, sometimes they get a little lazy and they want the easy way out. And doing male hormones, it's the easy one, right? Females are a little bit more complex, but it's not something that you can't learn. You just have to learn it. There's a lot of different organizations out there, accredited organizations, that will put you through the different type of testing, the urine hormones, the blood hormones, every type of testing that's out there for you to really understand these females that are coming into your practice. And really, the medical providers that are out there that are not really treating females, I think that's an untouched market that if you specialize in it, you can do very, very well financially on a business standpoint. So it's just they have to make that commitment and start learning about female hormones.
Yeah. I think there's so many points to what you just said that are valid beyond belief, right? Is that physicians have never been great business people. And I wouldn't have known that until I ventured out into my first business. But I will say that the perseverance and the drive it took to do that, and I was doing it at a different age. I wasn't starting at 19. I wish I had, because I love the business aspect of it. But I think that they do need to learn outside of traditional medicine. So when you hear physicians now shutting down hormones, and I think men are more accepted than women, but they're going to do one of two things with women. They're either going to scare them or they're going to refer them out because they don't know. And I would prefer the second. But they're doing that because there's no incentive for them learning that pathway, right? Because we're going to do what we're taught, and 50% of what we learn in med school, and I would say way more than that, is not true by the time we get out and practice. And sometimes the way we learn hormones might not even be practical, so you have to, at first, and now that's progressed, where providers can learn it a lot easier in a practical way. But I think what you bring up is that we can offer regenerative treatments. Hormones are a harder thing to learn, but the sexual wellness isn't.
Right.
And it's safe. So if they even want to get out by doing that first, you can remotely work with somebody that does hormones, like your, businesses or mine, where we can kind of manage and guide in some way, where there's a collaboration.
Absolutely.
But at least do the sexual wellness part of it, because that is something that's easier to learn in an untapped market. in a hugely needed market in
I
Kaplan
agree.
medicine. So
I
that would
agree.
be my suggestion. And you're right. Like, again, we wouldn't have mainly physicians employed right now, not even owning their own practices, if what you said wasn't true.
That's
So
true.
I think it's time
Yep.
for a little change.
Absolutely.
Yeah.
I agree. And we're here to support it. I always make myself available as much as possible to help providers, get where they need to be and help their patients,
Yeah.
achieve their health and wellness goals.
Well, and I think as you started, your business in Liquavita, I think it's expanded as you've seen the need for it, right?
Absolutely.
And I think that's going to continue and that's going to grow because I think there's a lot of physicians and providers extremely unhappy,
Yeah.
extremely unhappy.
Very.
They're there to help patients, but they're being told how they can help patients. So I think that provides an opportunity for somebody. You don't have to create a new path.
Right.
Now there's some pathways that exist.
That exists, right?
And the sexual wellness piece of it can be an easier and safer thing for them to start with, even if they never got into the hormone.
Yeah.
And just as long as they have somebody else managing that hormonal component that does it well. And
They
does
can make it
safely.
happen.
So, yeah. Little
Teamwork
changes.
makes the dream work,
That's
right?
right.
So,
Yeah.
Dr. Durst, if people want to find you, how do they find you?
So I'm on YouTube. Like, we have a channel on YouTube, RevitalyzeMD. And again, that channel started a while back of video podcast. So we're also on all the podcast channels and on Instagram. And I think for me, the big change for me that's coming is really doing probably a different YouTube channel with just my stuff so that I can talk about even business stuff that my viewers don't necessarily want to hear on the other. But I think that just getting out there and doing it and looking, if you look at me or Revitalize, it's just us talking about almost sexual wellness now. But I think I love the business aspect of it. And
Absolutely.
so there's other things I want to talk about, but I'm not sure my patients really care to hear much about that. So it's easy to find, but I think there's been such a grind in the build out over the last 7 years
Right.
that I'm just getting to the point of creating more avenues of education
Absolutely.
for patients.
Do you guys
So,
have an
yeah,
Instagram page?
we do, yeah.
What
I
is
have
it?
Dr. Debra Durst.
Awesome.
Yeah, but I just did that personal one again versus the business.
Right.
So we're just kind of, again, the marketing piece evolving right now because that's the part we love because you need to get the information out there.
Awesome.
And I love the video podcast, so I really thank you for inviting me down.
So this is another sexual health podcast. You got a lot of information. Always remember, if you're in love, wear the glove. All right. Make sure you subscribe, follow, like, share, do all the fun stuff. Until the next one. Again, Sam with a Healthy Point of View podcast.